As Dan mentioned, I'm an orthopedic surgeon. I have a PhD in molecular biology. My research topic for my PhD was how bone cells adhere to human biomaterials whenever we do joint replacements. And that led me into stem cell research. I actually used to run a stem cell research lab at the University of Pittsburgh. And so I did that for about 7 years. And then I moved to California into private practice. And the reason that I did that primarily was because, when you look at the stuff that we were doing from a stem cell perspective, just sort of projecting into the future, it seemed to me that it was going to be about 20 to 30 years before stem cell was really going to be a viable clinical alternative. And in the meantime, I had the opportunity to really work on joint replacement technology as well as developing implants. So I'm proud to say that there's actually 10 implants on the market that have my stamp of approval that I helped design. And it's probably translated to about 500,000 patients who've received one of the implants that I've helped design. So I'm proud of that. But one of the things that I've really noticed in the last 25 years and taking care of patients is that it's actually become more difficult to take care of patients. And there's a lot of reasons for that. And the pandemic didn't help. But one of the big reasons is that, patients have become less healthy. And so their ability to recover from surgery has diminished. And there's clear-cut data that shows that nutritional status correlates directly with how people recover from surgery. It makes sense. The healthier you are, the better you're going to be able to heal from wounds and fight off infection, et cetera, et cetera. So there's definitely a need for this, but there's never been a really good way up until now in my practice to implement this. And so when Jerry actually showed me this, that's when I got excited about being able to do something for my patients. So I think you've all seen this sort of a slide here before. An apple a day keeps the doctor away. It's an old cliche, but as all cliches, there's some truth to the cliche. And when you're thinking about apples and fruits and vegetables and eating healthy and all those things that your mother told you to do, the reason behind it was because there was a value to the fruits and vegetables in preventing disease and helping you to maintain a healthy lifestyle. And the reason is because fruits and vegetables are rich in these antioxidant chemicals. And I'm going to talk about those a little bit more. So antioxidants are a variety of chemicals that have the ability to protect our cells from free radical damage. The basic chemistry of that is that free radicals are these molecules that have an extra electron that are roaming around looking for something to attach to, because having an extra electron that's not attached is what's called a high energy state. And all systems want to be in a low energy state. So the way to get to a low energy state is to go and scavenge a electron from another protein or DNA from another molecule, basically. And that causes the free radical to become low energy. But now it pushes that other molecule into a high energy state. But not all molecules have the ability to be free radicals. So and a lot of these molecules, like proteins, when they get into that situation, they just degrade and fall apart, and they no longer have a function. So we need our proteins to be functional, because that's how all the chemical reactions in our body happen, is through the mechanisms of the proteins. Similarly, when free radicals go and attack DNA, it causes the DNA to break down. So when DNA breaks down, there are these mechanisms that allow the DNA to get self-repaired in your body. But if the damage that's occurring is happening more rapidly than the repair mechanisms can work, then the DNA degrades. So that causes one of two things. When the DNA degrades, it actually can lead to cell death, which is bad, obviously. But worse is that it can actually turn on certain genes that then turn those cells into cancer cells. And so studies have shown that by having high levels of antioxidants, you lower the risk assessment for cancer, amongst other things. But a lot of chronic diseases like diabetes and cardiovascular diseases, things that have chronic inflammation as a major underlying factor for why they develop in your body. So again, you've all seen this before. We need fruits and vegetables, and we just don't get them. Our diets in America are terrible. Even the CDC recommendation of 5 servings a day is probably not being achieved, by more than 10% of the population. The problem with that is that those recommendations are based upon data from the 50s. And with all of the pesticides, GMO, and everything else, and the soil is actually losing their nutrients. The fruits and vegetables that we have today just aren't nearly as good as they were once upon a time. So apples are 38% less good compared to 50 years ago. And, one orange of 50 years ago equals 21 oranges of today in terms of nutritional value. So those are the things that we need to address. So just to summarize where the science is coming from and what the scientists who've been doing this research have been looking at, we know that fruits and vegetables are important for preventative health. We as Americans, plus the rest of the world for that matter, but Americans specifically don't get enough. The recommendations are probably too low because the nutritional value of our food is not nearly so good. So what can you do? You have two options. One option is to take 12 to 15 servings of fruits and vegetables a day. Hard to do with our lifestyles and our diets. Or you can take supplements, because what the supplements provide is they provide those missing nutrients from your fruits and vegetables, and that's been clearly studied. Now, there are a lot of different micronutrients and a lot of different vitamins and all the different fruits and vegetables. But one of the things that is the largest group, there's over 1,100 of these, are carotenoids. And the reason that carotenoids are important for our purposes is because this actually gives us the ability to measure something. But before you even think about measuring it, you got to know that carotenoids actually are valuable, in the body. Not just that there's a lot of them, but that they're valuable. And you also have to understand that the supplements that you're getting need to have high enough levels of not only carotenoids, but other micronutrients. So oxidation, this is basically what causes free radical production. You see it every time you cut an apple and you let it sit on the counter, it starts to turn brown. The sugars that are exposed to the air are now becoming oxidized, and that's what's causing the brown discoloration that you see on the right-hand side. The left side apple has been painted with a little bit of lemon juice, which has citric acid. And citric acid is a really nice antioxidant. So that prevents the apple from browning and oxidizing. So as I mentioned before, we're trying to prevent protein destabilization and damage to DNA that could either lead to cancer or cell death. So oxidative stress is not just a dietary thing. There's a lot of things in our lifestyle that cause oxidative stress. Diet, obviously, poor diet adds to it. Obesity is a problem. Airline travel, smoking, excessive sun exposure, pesticides, high stress jobs, all of these things will cause oxidative stress in your body, which then causes increased free radical production in your body, leading to protein breakdown and cell death. So there are a lot of diseases that can be directly tied to oxidative damage. Cancer is the biggie: prostate, breast, ovarian, those are the biggies. But other things like Alzheimer's disease, Parkinson's, diabetes, stroke, coronary artery disease and heart attack, arthritis, chronic fatigue syndrome, asthma, sickle cell as a classic oxidative stress scenario, and probably the worst of all, male infertility. So a lot of the study has come from certain labs. So I just highlighted one lab here. Torsten Bohn at the Luxembourg Institute of Health has done a lot of research. In fact, if you do a PubMed search on him, you'll find about 20 pages of his papers. But I just pulled 3 out here to just look at what have they shown that is really important for us to understand. So they've shown that carotenoids specifically will quench free radicals. And that actually, in addition to decreasing the number of free radicals in your body, it actually activates your antioxidant system in your body to decrease free radicals as well. Carotenoids directly block oxidative stress by having an anti-inflammatory effect. They also prevent cells from self-killing themselves. So that's actually a real thing, is that when cells reach a certain number of cell divisions, they'll just go through something called apoptosis, where they will actually commit suicide. Now, sometimes you want cells to do that whenever they're severely damaged, but most of the time we don't want cells to do that, particularly as we're aging. So the carotenoids will help block cell death. And then again, we've talked about the antioxidant activity and the role of that. The other thing, and this is an important thing, it sounds kind of silly, but this last line here is an important thing to understand. It actually has been shown that low serum and tissue carotenoid levels will correlate with increased incidence of chronic disease. So, if you're not getting enough fruits and vegetables, you're not getting enough antioxidants, you're going to have a higher chance of developing chronic diseases. Okay, that makes sense. But the converse has to be true for it to have any therapeutic benefit. And in fact, Bohn has shown that the converse is true, that if you increase the levels of carotenoids in the tissue and in the serum, that will lead to a decreased incidence across a population of chronic disease. So both need to be true for it to have any therapeutic value. So, I mentioned some of the diseases, and I've kind of, talked about some of the mechanisms. But if you go and actually pull all the, cull the literature and look at a bunch of papers and how what people have studied, they've shown that serum carotenoids will actually have direct anti-inflammatory effects. They've shown that in the heart, so when you have inflammation in your heart vessels, that leads to endothelial damage, and that's what causes atherosclerosis, which leads to, hardening of the arteries, and then eventually heart attack. So direct effect on anti-inflammatory effect. It also helps in spinal disc disease and certain arthritis type conditions where the low anti-inflammatory effect actually decreases pain and stiffness. I talked about autophagy modulation, which is cell death. So obviously the carotenoid levels will correlate with that. Something that's very interesting is, in addition to helping prevent the onset of cancer, there's evidence that high carotenoid levels will actually stop cancer cells from being able to proliferate. And I think that has to do with this something called gap junction stabilization. So gap junction stabilization means the following. So between your cells need a way to talk to one another. So for example, if you're talking about the lining of your gut or the lining of your heart vessels, the cells that line those quote unquote tubes are in direct contact with one another, but they have to have a way to communicate with one another. And so they communicate with them through these gap junctions. But if the gap junctions become very wide, then the spaces between the cells become too wide, and then the signal molecules won't go from one cell to another. That's one problem, but it also opens up the lining to damage from the materials that's inside the tube. So in your gut, the bacteria, in your blood vessel, the high cholesterol and the high lipids will that actually cause damage. So gap stabilization is something that's been shown to be to occur from high carotenoid levels. So that's important. This next line here, Wnt beta catenin signaling. So I can spend 4 hours talking about Wnt beta catenin signaling, because this has to do with how almost all signals are transduced in cells for proliferation, division, healthiness, turning on genes, turning off genes. It's a very important signal transduction pathway that you see in most species. It's been preserved during evolutionary times across all not only species, but in different species within our species. So it's really important. But again, for our purposes, antioxidant levels will correlate with better signal transduction using this pathway. So that becomes very important for cell health. In terms of the immune system, antioxidant levels have been shown to directly correlate to proliferation of B cells and T cells. So these are the cells that present infectious bacteria and viruses and help to kill those same bacteria and viruses. So this is, again, not surprising that we're seeing that antioxidant levels have an effect on the immune system, because they actually affect directly the components of the immune system. And there's a lot of other mechanisms that have been studied here, but that's basically what I'm trying to say is it's really important that the science is good, and it's actually the work that's been done measures things that we know in other disease situations need to be measured. So just diving down a little bit into some of the individual more common diseases. So this study here from Rubach's group basically shows that not only do carotenoids in the serum and tissue help to prevent diabetes from occurring in patients who are at risk, but in patients who've already developed it, it actually helps us increase insulin sensitivity, which means that's actually a way to treat diabetes. If you recall, diabetes means high blood sugar levels. And when you have high blood sugar levels, insulin is the hormone that pushes those blood sugars, that blood sugar into the cells. When the blood sugar in the serum or the blood stays really high, when the sugar levels in the blood stay really high, that's what causes the chronic diseases from diabetes. That's why we want insulin to push that sugar into the cells and tissues. And so the carotenoid levels actually help to increase the cell's ability to react to insulin and pick up the sugar from the bloodstream. So the long-term consequences of diabetes, these are the biggies: neuropathy, retinopathy, nephropathy, which means kidney damage. Infection is a common problem in diabetics. So having high antioxidant levels will help to stabilize all of these problems from happening, because they make the effect of the diabetes less severe. In terms of cancer, again, this is just a quote I took from this review paper from Milani, which basically shows that epidemiological studies have shown a correlation between high carotenoid intake in the diet and a reduced risk of breast cancer, cervical cancer, ovarian cancer, cardiovascular disease, eye disease, prostate cancer, et cetera. And the risk reduction is anywhere from 1 to 1.5 times. That's a pretty significant risk reduction when you consider something like breast cancer that affects 11% of all women. So if you get a one-time reduction, you have the potential to drop that incidence from 11% down to 7%. So that's pretty significant. In terms of heart disease, a lot of different things have been shown. So number one, plasma carotenoid levels were inversely correlated with systolic and diastolic blood pressure. Makes sense. The lower your blood pressure is going to be, the less damage is going to happen to your blood vessels. So the skin carotenoid score and plasma carotenoid levels, as they go up, the blood pressure goes down. So that helps protect your blood vessels and your heart. Additionally, every 1,000 increase in the SCS actually decreases, has an odds ratio decrease of about 1 in terms of metabolic syndrome and moderate to high risk cardiovascular disease. So metabolic syndrome is a situation that typically happens when you have obesity, diabetes, poor nutrition. You get damage to a lot of your internal organs, including the liver and the kidney. So metabolic syndrome is bad. We want to increase our SCS to decrease the risk of metabolic syndrome. And then lastly, vitamin A and carotenoids definitely have important role in reducing incidence of heart disease. So, why Pharmanex? You've heard this before, but I just want to reiterate it because the BioPhotonic Scanner is the only non-invasive way to measure what's happening at the skin level in terms of antioxidant levels. Any other way to measure what you're doing requires blood tests, and you're actually not measuring antioxidants directly. You're measuring particular vitamin levels, micronutrient levels, things like that. So this gives us a direct correlation between what we're taking into our body and how much is being retained and is being measured through the skin. The basic principles on this absorption spectrum, which again has been studied since the 1920s, and how you do absorption, and every molecule, every protein, every strand of DNA has an absorption spectrum. So it's a really powerful way to study, what chemicals are in a particular, soup of chemicals, if you will. And so the carotenoids, that whole group of carotenoids has one particular wavelength of emission. And so it's very easy to capture using the BioPhotonic Scanner. But then that then begs the question, how valuable is the SCS? I mean, you can get this measurement, but does it correlate to anything? Does it help us get an understanding of whether we're treating any disease or not? And the short answer is yes, because two important things. Number one, the SCS has been studied and there's been hundreds and hundreds of publications showing what the SCS correlates to, whether it's heart disease, diabetes, sugar levels, cancer incidence, all these things. So there's a correlation between the SCS and all of those diseases. And the most important thing is kind of what we're talking about. And the whole premise of this is that if you're a person who has a high intake of fruits and vegetables, that correlates to your SCS score. So the more fruits and vegetables you eat, the higher your SCS score is. So the whole premise is we want to increase SCS score by increasing those micronutrients and antioxidants. If you don't get them from your fruit and vegetable in your diet, you get them from your supplements. And the supplements are going to cause an increase in the SCS, and we know the SCS correlates with better health. So that's the direct link. And I think it's important. It was important for me as a scientist and a physician to do more than just take everybody's word for it. I mean, the science and what's coming out of Pharmanex is good, but it's published and it's been peer reviewed, and there's hundreds and hundreds of publications talking about it. So that gave me an extra level of comfort in knowing that the science on the SCS is real. The science on the antioxidants and their role in chronic disease is legit. So as a physician and anybody else in the healthcare space, you can feel comfortable that the concept of promoting supplementation is going to help with preventative health. It's an important modality. And therefore, as I'm going to learn more this week, but from what I've already read and studied, we can feel comfortable with the Pharmanex products that we're talking to our customers and patients about. So I will stop there. Thank you very much. And if there are any questions, I'm happy to answer them.
Awesome. Dr. Sinha, I first want to say thank you very much for giving us a dumbed down version for us non-scientific folk who maybe have a hard time understanding some of this. But more than that, coming from an orthopedic sales background myself, I'm always fascinated to hear from an orthopedic physician why this makes sense, because orthopedic physicians see a lot of patients, because there's a lot of patients with, osteoarthritis, broken bones, rheumatoid arthritis, musculoskeletal issues. And so my first question is, how, for an orthopedic surgical patient, how does knowing skin carotenoid score and then treating these patients that are low with a high quality nutraceutical that is guaranteed to increase their score, how does that help with patient optimization? There's a big push going on, in the last 5 or 10 years with how do we optimize these patients? For number one, for reimbursement reasons, but how does this benefit the patient and the physician in optimizing these patients pre-surgically? And then how does that help them post-surgically with recovery?
Yeah, it's a very good question. And for all surgeons, it's an important concept. So we know that there are a lot of risk factors for our patients going into surgery. So for something that I do, for example, a hip and knee replacement, this has been studied so well over the last 50 years. I mean, it's gotten to the point now where we can predict risks in a right-handed, redheaded female, who has 4 children. You can predict what the infection risk is going to be, and the data is that granular. So what we've found out is that patients who have poor nutritional measures have increased risk of not only wound healing problems, which leads to infection, but also things like stroke, heart attack after surgery, and pulmonary disease like pneumonia. Thank you. I'm blanking on the word, pneumonia. So all these things that occur after surgery are not only are they going to affect the patient's ability to recover from the surgery, but it's going to have a long-term effect on their health. So for example, somebody who's got a sore hip is walking around limping, they're going to have one set of problems because they don't get exercise, et cetera, et cetera. But if I fix their hip and I've given them a pain-free hip, but now they've had a heart attack as a result of the surgery, have we really made them any better? That's the debate that we face. Now, you mentioned the reimbursement thing. So there's this whole move in medicine away from paying people for service, people being healthcare providers, and instead paying them for outcome. So in the hip and knee replacement space, there was this concept called bundled payments, where Medicare said, okay, the episode of care is going to cost about, this much money. This is what we're going to allocate to it. If you can somehow save us money, we'll give you a piece of that savings. Sounds great in theory, but the upshot of what happened was either one of two things. Either practices couldn't manage that well enough and they lost a lot of money, or worse, they decided to cherry pick their patients. And they said, okay, we're only going to operate on the healthiest of the healthiest because we don't want to risk losing money if a patient has a known comorbidity that could lead to a complication after surgery. I don't think restricting access to healthcare is ever the goal in the health system, but that was the unintended consequence. And now with Medicare proposing a 9 to 10% pay cut in 2023, I think the next thing that we're going to see is we're going to see more practices either limiting how many Medicare patients they see or pulling out completely. So what do you do for those patients? As an orthopedic surgeon, okay, that's one issue. But if you're a primary care doctor, if you're a family doctor, if you're an OBGYN or a pediatrician, basically seeing patients on the front line, you're going to have limited access to those patients. So you need to create a methodology by which the patients can help themselves. And I think this is one example of what that type of methodology is.
Awesome. I think that was a fantastic explanation. There's been a lot of, you mentioned that this could help patients with osteoarthritis. There's some good data out there from an orthopedic perspective on bone graft, the ability of bone graft to grow with lower oxidative stress. Mm-hmm. We know that rheumatoid arthritis is an inflammatory process, an immune problem that can be helped. But I saw something on the CDC website the other day that 4 in 10 patients or 4 in 10 people have one chronic disease. 6 in 10 people have one or more or two or more chronic diseases. So do you think that is a direct result of some of the things you talked about in the early on in your presentation, from a fruit and vegetable degradation standpoint, from us not eating as many fruits and vegetables, GMO, pesticides, herbicides, all of those different things that are being put into our food, and then obviously higher sugar content, salt content, and things like that in our diet? And this is a consequence of all of those things. And how many of those patients, from an orthopedic perspective, I think I kind of answered my question, but how many have these chronic problems?
Well, let me answer the second question first. So in the joint replacement space, which is what I work in, everybody has a chronic problem, because it's the age group, right? People who have arthritis that need replacements are in their 50s, 60s, and 70s. So they're going to be in that age group where they're going to see chronic diseases, because a lot of the diseases that we're talking about are the effect of aging. Remember, in the year 1900, the average lifespan in America was 35. So if most people were dying in their mid-30s, we weren't seeing all of these health problems because, the accumulation of oxidative stress didn't happen. So the second part of that, and the first question you asked me, is what's the cause of it? I think it's that slide that I showed that listed all the different things. I mean, diet is definitely one factor. Genetics is a factor, but, probably less of a factor. Obesity, so that comes back to diet, because our food, forget about fruits and vegetables, just our food in general is not good food nutritionally or from a fat content. And so, we are killing ourselves by the food that we eat. And so not only do you need to improve your fruits and vegetables, but you need to address those other issues like obesity, exercise, limiting your red meat content, all that sort of stuff is important.
Yeah, so another statistic that I saw, there's $10 trillion spent in healthcare worldwide. Interestingly enough, the US spends about 4.1 trillion of those healthcare dollars. And we are the only country that is actually trending downward in longevity. So we have a serious problem here in the United States. I mean, other countries are trending upwards by spending less money. So they're starting to focus on the right things, and we're continuing to focus on the wrong things. But from an orthopedic perspective, is there a financial reason from a procedure or a surgical perspective for an orthopedic surgeon to help their patients optimize nutritionally pre and post surgery? Is there a financial reason from a reimbursement perspective? I think you kind of covered that, but could you go into a little bit more detail?
It's sort of the dirty thing to talk about in medicine, right? We don't ever want to talk about finances, because that's not ultimately why any of us went into it. Most of us, maybe some of the sociopaths, but most of us didn't go into it for money, because, for the last 30 or 40 years, in the last two generations at least, the concept that physicians would make a comfortable living was, unquestioned. But in the last decade and a half, what we're seeing is that physician income is just dropping. It's dropping much more rapidly, even before this crazy inflation burst. Physician reimbursement, payments to physicians, was dropping faster than the cost of living was going up. And so, we still have to pay our staff. We got to buy equipment and supplies and all that sort of stuff. And so the only place where that money could come from was the physician taking less home. That's the only source, because they weren't getting paid more. There's only so many patients, only so many surgeries you can do in a day. So, this is a nice side effect, is that you have a financial incentive to not only help patients with their health, better outcomes with their surgeries, et cetera. But you got a little kicker to help offset some of those other problems that we see in our day-to-day practice of medicine, financial problems specifically.
Yeah, and I wasn't talking specifically from a physician perspective, but from that whole episode of care perspective, because I know if a patient has a comorbidity, or you do a total joint replacement and they have a PE afterwards, that's all included in that episode of care. So if we can help these patients optimize them prior to surgery by lowering their blood glucose levels, controlling their glucose levels for a diabetic, helping these patients become healthier on a cellular level, theoretically, it should help mitigate some of those problems that could potentially cause these, what do you call them, drawing a blank on the terminology,
Complications.
complications that could potentially end up taking a procedure from one that's barely profitable to one that's negative.
Yeah, and again, it's sort of that dirty part of the conversation is, what's the goal here? Is the goal to just take care of people? Is the goal to make money? And depending on who you talk to in the healthcare system, that's a whole conversation I could have, and I have my opinions about that. But it turns out, and I actually did this study over several years in a hospital that I moved my practice to that really didn't have much experience with hip and knee replacement. But I basically went into the hospital and I went to the CEO and I said, look, I'm going to bring 400 surgeries a year to your hospital, which you can calculate what that means in terms of revenue. But what I want to do is I want to focus on the medicine. I want the opportunity to optimize the best medicine. And let's see what happens in terms of outcomes. So not only do we improve the outcomes, in fact, this was in a tenant healthcare system. So out of 73 hospitals, we had the lowest complication rate. We had the fewest readmissions through the emergency room, the fewest days in OR, and the highest profitability per case. Why did we do that? Because the best medicine is actually the cheapest medicine. It's kind of intuitive, yet that's not the way we practice. In hospitals and stuff, we're practicing to address a line item as opposed to the overall health and wellness of a particular patient.
Okay. Well, I'm going to stop taking up the limelight here with my questions. I'm going to open it up to everybody else really quickly. If you have a question for Dr. Sinha, please come off of mute and ask your question, and then we'll wrap it up for the evening. Any questions?
I think one of the things that's apparent, it's growing over the past few years, is the physician suicide rate has actually doubled that of the general population. I think a lot of that can be contributed to the stress and the cutbacks in reimbursements and seeing that's necessary to do more surgeries, see more patients. It's a real problem, and it's a growing problem that needs to be addressed.
Yeah, so much so that burnout is something that we talk about at all of our society meetings, physician burnout. No doubt about it.
Yeah.
There's a question in the chat I see. However, implemented in my practice, what's the process? So I just moved from California to Texas. I'm in the process of opening a new practice, but the way to make it work, I believe, and the way that I was doing it in my practice in California was that everybody was getting a scan, and it was just part of the medical assistants rooming the patients. And then, while they were sitting there waiting for me, they were given a brochure to look at, and then we'd come in, we'd talk about the hip or the knee or whatever the issue was, and then at the end of it, I would see them holding the brochure. And before I went into the rooms, I would look to see if they were taking any supplements, already. And if they were, it was a very easy conversation, because I would just look at them and say, what was your scan score? And they'd say 21,000. And I would say, well, see, you're taking these supplements here. They're not doing anything for you. And that's what the scan score is showing. So these are your options: increase your fruits and vegetables, or, change your supplement to something like Pharmanex. And, it's what I learned is that when patients are coming in to talk about their hip or their knee, getting a preventative health lecture is not something that they're ready to receive. But on the next visit, that's when they wanted to talk about that even more so than their hip or their knee problem.
Mm-hmm. Thank you. Any other questions?
See, there's one more in the chat that just came up.
Okay.
Yeah, I don't know how to answer that question. What is the best way, in your opinion, to get to see a doctor? You mean a doctor who's providing the Pharmanex?
No, probably to how to get in front of a doctor to talk to him about Pharmanex.
Oh, I see. That's a good question.
We can talk about that all night.
Yeah. That's the sales issue. So, for me, I was introduced to this by Jerry, and Jerry introduced it to me in the summer. And I think it was almost 6 months before I had Dan come out and set up my staff. 6 months or more even. So for me, it was just a process of, accepting that I wasn't doing everything that I could for my patients, number one. Number two, trying to find a way to not only patients, but even my family, because like all my family is, were taking it as well, taking the supplements as well, but a way to get healthier for myself and my family and my staff if they were interested in doing that. And then, thirdly, the increased revenue was attractive, but I honestly didn't really understand how much revenue can be generated. I mean, I looked at it and I said, yeah, that's a nice side effect. I mean, basically all I was worried about was not losing money on it. But then more recently, I had the opportunity to really sit down with Michael and go through the financial aspect of it. And I think, not all physicians will respond to it, but if it's a way to show them that you can decrease their overhead, for example, by this methodology, and they can actually they're going to hire more staff, et cetera, because they have a new income stream. To me, I think that was sort of the magic bullet for me personally.